Heart failure, HF. What is heart failure? HF. 1. Definition. Heart failure, HF, also known as congestive heart failure, CHF, is a clinical syndrome characterized by the heart's inability to pump sufficient blood to meet the metabolic demands of the body, or the heart can only do so at an elevated filling pressure. 2. Impaired cardiac function. It is usually associated with structural or functional changes that impair the heart's ability to fill with blood or pump blood out, but it can also be associated with other conditions, such as arrhythmias. 3. Progressive condition. Heart failure is a progressive disease, meaning that it worsens over time. Types of heart failure. Heart failure can be classified in various ways, including 1. Based on ejection fraction, EF. Heart failure with reduced ejection fraction, HFrEF. Often referred to as systolic heart failure. This is a condition where the left ventricle cannot pump enough blood with each contraction. The ejection fraction, the percentage of blood ejected from the ventricle, is reduced, usually less than 40%. Heart failure with preserved ejection fraction, HFpF. Often referred to as diastolic heart failure, this is a condition where the left ventricle can't fill properly because the heart muscle is too stiff. The ejection fraction, the percentage of blood ejected from the ventricle, is normal or near normal, usually greater than 50%. 2. Based on affected side of the heart, left-sided heart failure, the left ventricle is unable to pump enough blood into the systemic circulation, leading to a backup of fluid in the lungs, pulmonary congestion. Can be further classified as systolic or diastolic. Right-sided heart failure. The right ventricle is unable to pump enough blood to the lungs, leading to a backup of fluid in the systemic circulation, leading to peripheral edema, often a consequence of left-sided heart failure, but can also occur independently. Biventricular heart failure. Both the left and right ventricles are affected. 3. Based on onset. Acute heart failure develops suddenly, often due to a severe cardiac event, such as a heart attack or sudden arrhythmia. Chronic heart failure develops gradually, usually as a result of long-term cardiac conditions. Pathophysiology of heart failure. Heart failure has a complex pathophysiology involving several interconnected mechanisms. 1. Impaired contractility. Myocardial damage, damage to the heart muscle, such as from a heart attack, ischemia, or cardiomyopathy, reduces its ability to contract effectively. Reduced contractility reduces the force of contraction of the heart. 2. Increased afterload. High blood pressure. Elevated blood pressure or aortic stenosis increases the resistance against which the heart has to pump, leading to ventricular hypertrophy, enlargement. Increased afterload. Increased pressure the heart has to overcome to pump out blood. 3. Increased preload, fluid overload. When the heart can't pump effectively, it can lead to fluid overload, increasing venous return and the amount of blood in the ventricles, which increases preload, which can make the situation worse. Increased volume increases the amount of blood in the ventricles at the end of diastole. 4. Neurohormonal activation. Sympathetic nervous system, SNS. Activation of the SNS leads to increased heart rate and blood pressure, which increases afterload. Renin-angiotensin-aldosterone system, RAS. Activation of RAAS leads to sodium and water retention, which increases blood volume and preload, making the problem worse. Natriuretic peptides. Elevated levels of natriuretic peptides, like ANP and BNP, which cause fluid excretion, but these are unable to overcome the problem of heart failure. 5. Ventricular remodeling. Structural changes. Over time, the heart undergoes changes in its size, shape, and structure in an attempt to compensate for impaired cardiac function. Ventricular hypertrophy. The heart muscle can enlarge and become stiff and less effective. Fibrosis. The connective tissue of the heart can increase, causing stiffness. Signs and symptoms of heart failure. The signs and symptoms of heart failure vary, depending on the side of the heart that is affected and the severity of the condition. Common signs and symptoms include 1. Left-sided heart failure, pulmonary congestion, shortness of breath, dyspnea, especially with exertion or when lying down, orthopnea, paroxysmal nocturnal dyspnea, episodes of breathlessness at night, and coughing. Fatigue and weakness. due to reduced cardiac output and blood flow to the rest of the body. Pulmonary rales, crackling sounds in the lungs on auscultation. 2. Right-sided heart failure. Peripheral edema, swelling of the legs, ankles, and feet due to fluid buildup. Jugular venous distension, JVD. Distension of the jugular veins in the neck due to increased venous pressure. Hepatomegaly, enlargement of the liver. Ascites, fluid buildup in the abdominal cavity. 3. General symptoms, fatigue, generalized tiredness and weakness. Reduced exercise tolerance, shortness of breath and fatigue with normal activities. Nocturia, frequent urination at night. Weight gain, fluid retention can cause weight gain. Tachycardia, increased heart rate. Diagnosis of heart failure. 1. History and physical examination. Assessment for typical symptoms and identifying risk factors. 2. Echocardiogram. Assesses heart structure and function. Evaluates the size and function of the heart chambers, valve function, and ejection fraction. 3. Electrocardiogram, ECG. Detects arrhythmias to evaluate for irregular heart rhythms. 4. Chest X-ray. Evaluates for pulmonary congestion and cardiomegaly. Looks for fluid in the lungs and enlargement of the heart. 5. Laboratory tests. BNP and NT-proBNP. B-type natriuretic peptide and N-terminal pro-B-type natriuretic peptide are hormones released by the heart that are elevated in heart failure. These lab values can be used to both diagnose and assess response to therapy. Electrolyte levels, to evaluate for electrolyte abnormalities. Kidney and liver function tests, to assess organ function. Management of heart failure. 1. Lifestyle modifications. Sodium restriction, limiting sodium intake. Fluid restriction. In severe cases, limiting fluid intake. Weight management, weight loss for overweight or obese individuals. Regular exercise, regular low-impact exercise. Smoking cessation, important for overall cardiovascular health. Alcohol limitation, limiting alcohol intake. 2. Medications. Diuretics. Reduce fluid overload by promoting fluid excretion in the kidneys, decreasing preload. ACE inhibitors and ARBs. Block the RAAs and reduce afterload. Beta blockers. Slow heart rate and reduce blood pressure. Aldosterone antagonists. Block the action of aldosterone, reducing fluid retention. Inotropes. Increase heart contractility. Use is limited and primarily used for acute situations. Digoxin increases contractility but is not often used. Vasodilators can reduce afterload. SGLT2 inhibitors. A newer class of medications that are used for diabetic patients with heart failure to improve both glucose control and heart failure outcomes. 3. Device therapy, implantable cardioverter defibrillator, ICD, to prevent sudden death from arrhythmias. Cardiac resynchronization therapy, CRT, pacemaker to coordinate ventricular contractions. Left ventricular assist device, LVAD, mechanical pump to assist the heart. 4. Heart transplant. In severe cases, heart transplant is an option. 5. Palliative care. For patients who are no longer responding to traditional treatments. Dr. Hammer leans back, his tone summarizing and serious. All right, student. Heart failure. It's a common and serious condition that involves the heart's inability to pump blood efficiently, and there is a complex pathophysiology that causes this. You must understand the different types, their underlying causes, the signs and symptoms, the diagnostic process, and the various treatments. It's a very important topic in medicine, and you need to be comfortable with how to help manage your patients with heart failure. Key takeaways. 1. Heart failure is a syndrome where the heart can't pump enough blood to meet the body's needs. 2. It can be systolic, HFrEF, or diastolic, HFpEF. 3. Symptoms include shortness of breath, fatigue, edema, and fluid retention. 4. Diagnosis involves history, physical exam, echocardiography, and lab tests. 5. Management involves lifestyle changes, medications, and sometimes device therapy or heart transplant.